Around 1 in 8 women experience postpartum depression, and thankfully there are numerous resources across the nation these moms can lean on during such a stressful time. As mental health has become a more common conversation, awareness around PPD has grown as well. But what's lacking from this discourse is the fact that men are also having these experiences, which have been labeled paternal postpartum depression.
About 1 in 10 fathers deal with postpartum depression, and there's a heightened risk around the 3 to 6 months postpartum when they are getting more involved with the child, that they start to feel that stress and heightened risk for developing depression. But of course, we also understand that this extends even beyond the first year postpartum, up to about 5 years when the father is at risk for developing depression.
That's Dr. Sheehan Fisher, Associate Professor of Psychiatry and Behavioral Sciences at Northwestern University Feinberg School of Medicine. His research focuses on fathers' maternal health. Fisher says the 3 to 6 month window of increased risk stems from dads being more involved with their children, but this rise in risk doesn't mean their involvement is a bad thing.
We want them to be involved, but just like with the moms, that if they deal with more stress, therefore that puts them at risk for depression, specifically and especially if you have a history of depression or other mood disorders or have a vulnerability to those things. So it's just kind of the combination between your own body and the environment that could put you at risk for developing depression.
Fisher says paternal PPD partially comes from men in today's world taking a much more active role in parenting without a lot of education or knowledge being passed down to them.
I think for men, especially current men, they, for the first time, are becoming the involved father. Many times their fathers were not involved as much, and therefore they want to be involved themselves without really a blueprint on how to do that. And we also don't have really the system support to help them. Like we don't have as much parenting education for them. We don't allow parental leave as much for fathers. So therefore they get either shortened leave, like 2 weeks, or nothing at all, which makes it harder for them to transition to this new role and for them to be fully involved as a co-parent. And so therefore these policies really kind of limit this transition, and it creates more stress upon the father.
Thankfully, there are programs available that focus on paternal PPD, such as Postpartum Support International. They have resources for both men and women that include support groups and mentor programs.
But I think there's a lot more we need to go to really have it more accessible. Like for one, perinatal mental health specialists need to get trained in father mental health because many times they're only trained it on the mom side. So I and other colleagues, especially through Postpartum Support International, have done trainings to different clinics and organizations and clinicians to make sure they're informed. One of my things I always push out is that I don't need everyone to be a father specialist, but I need to at least understand how the father relates to their work. So even if you're an OB-GYN or pediatrician, which the father is not your target patient, you still need to at least understand how the father's mental health affects your target patient and also how you can incorporate the father to the overall well-being of the family.
This full picture approach is crucial for the family's health. Fisher says that research shows a high correlation between one parent's mental health struggles increasing the second parent's risk as well.
If one person is depressed, there's a high risk that the other person will develop depression, and for either parent. So this is something we also want to take into account, that if you see, especially let's say the OB-GYN that sees a mom, if she's depressed, you should be looking out for, is their partner also depressed?
And obviously, the mental health of both parents has an incredible impact on their child. There's a long history of research showing the immense influence a mother's mental well-being has on the kid, but Fisher's research has revealed just how powerful the father's mental health is too.
The father's perinatal mental health has a direct impact on that child's internalizing, which is like the anxiety or sadness and depression symptoms, and externalizing the behaviors, which is like the misbehavior or aggression, similar to mom. So therefore, clinically, this matters because if we only treat the mom and support her mental health and well-being and get her well, we are still leaving that child at risk.
But if most parents want to do what's best for their child, why are so many fathers ignoring their mental health? Fisher says it's simply been lumped in with the general trend of men not taking care of their overall health.
Like we're talking about even physical health in general, men many times don't go to their PCP or their primary care physician or even take care of their symptoms until it gets like exacerbated. But then when we think about mental health, all the more so men are less likely to go see a psychologist or a therapist or a psychiatrist to support their mental health well-being. And this is all the more so during the perinatal period because fathers feel the pressure to want to be strong for their partner, for their family, and don't feel that they really have a space for them, that they aren't supposed to feel anything. So therefore, if they're feeling something, it must be something wrong with them as an individual.
They're also feeling these intense emotions during a time that's already a high-pressure, novel experience. For many men and women, it's easy to chalk up any weird feelings as part of the journey. Fisher says it's normal for parents to not even really be aware that their mental health has taken such a hit.
So often, especially if the mom is dealing with depression or other mental health issues or even medical issues, given like a high risk after delivery, they're so hyper focused on making sure she's okay. They are in like go mode. They're not really aware of what they're going through themselves. And therefore, sometimes it's not till much later they start to realize that they're not themselves and that they don't feel well, but don't always even have the language to explain what they're going through.
It's possible that they don't have the language because even scientists didn't really have a good grasp of male depression until relatively recently. Fisher says many men experience depression differently than the symptoms we typically think of. This subtype has been deemed masculine depression,
which means they may not be likely to report sadness or anxiety or feeling crying or something like that, but they might be more likely to experience hypersexuality, hyperaggression, including irritability, along with substance use.
Which means there's a possibility that many men with depression have been misdiagnosed because the medical professionals were analyzing the wrong symptoms. In fact, this recent data has led researchers to believe that the difference in depression rates between men and women hasn't been accurate.
There's a study done by JAMA Psychiatry on men in general, and basically we've always known the ratio for depression is about 2 to 1 for women to men. But what they did is they added in masculine depression symptoms, and that ratio went from 2 to 1 to 1 in 1. Which means basically they're at the same risk for depression in general for men and women. I am concerned we're looking at the same problem when it comes to perinatal depression, that we're underestimating how many fathers are dealing with depression during the perinatal period, which means that we then don't know how to best support that family if we're underestimating their risk of depression.
Fisher says the scientific community has been slowly integrating the masculine depression symptom scale into research, but it's not widely used just yet.
People are starting to now consider it within their clinical settings and within their research to include these additional measures, but I don't feel like we've gotten fully there to be able to then do a meta-analysis on understanding that within the perinatal field. But we do need to move in that direction. So I think we are making progress on the medical field to understand it, even though we still have a lot of, misinformation or bias against like some of the views around father mental health and trying to understand how it incorporates, but we're making progress.
The next step for Fisher is to make this topic more well-known in society.
Even as a researcher and a clinician, a lot of what I've done in my career now more recently is moving toward media and other outlets to make sure that we inform others in general about like how their mental health is impacted by going to parenthood, whether mother or father, but also seeing the relation between the two. So I think we do have to make sure that the public is more aware that this exists so they can prepare and be ready to be able to support each other as they go through this life transition.
You can find more information about Dr. Sheehan Fisher and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.